Positive COVID cases in southern Nevada may be going down, but doctors say they're seeing an alarming increase in cases among children. They say the symptoms are mild to moderate, but there could be serious life consequences down the road.
And 13 Action News reporter Abel Garcia now shares why more children may be getting COVID and also what you can do to prevent your child from getting infected.
I spoke to a doctor who says at the beginning of this year, she would receive 1 to 2 calls a month about a child testing positive for COVID-19. Now she's receiving calls on a daily basis.
With the new variants coming out and the Delta variant as well, we're definitely seeing a higher number in children.
Vegas pediatrician Dr. Atusa Ganion says the big concern now is the children.
We are seeing nationwide a higher number of cases of children getting the same respiratory symptoms as adults, requiring them to be on a ventilator for respiratory support.
Dr. Ganion says while children may have milder to moderate symptoms, being on a ventilator at a young age could lead to long-term complications, potentially causing lung damage. She says families need to do their part to avoid getting infected.
Try to minimize indoor activities, especially with large groups, and especially if you don't know the vaccination status of the other individuals involved. That will really help.
Southern Nevada Health District officials say since the beginning of August, we have seen more than 3,000 positive COVID cases among 5 to 16-year-olds in Clark County, making up nearly 11% of our area's cases.
Some of the children with the older children getting complications such as, myocarditis and pericarditis and getting inflammation around the heart as well. So it's really important to help avoid our kids from getting the virus in the first place.
Ganion says parents with children 12 years and older need to take action if they haven't already.
Unless there is a reason for that child not to get vaccinated, a certain medical condition, a certain reason not to, I would absolutely 100% encourage parents to get vaccinated.
As people continue to let their guard down, Ganion says we can continue to see cases go up among our children. Dr. Ganion says the most effective way to prevent your child from getting infected is by making sure every eligible family member within your household gets vaccinated. If they can't get vaccinated, she says to follow basic hygiene practices and to screen your child before they leave their house and once they return. Abel Garcia, 13 Action News.